Good evening, fellow interns. Am I audible?
Yes, ma'am.
Yeah. So, good evening, fellow interns. Today we have two incredible presenters, Akshata and Ritu Pitambar. Akshata from PharmD third year and Ritu Pitambar from PharmD fourth year, who will be presenting on the topic epilepsy. That is, they will be dealing with the pharmacotherapeutics part. So, I'll just quickly brush out the rules for y'all. So, the presentation will be taken in two halves. The first presenter will cover the first half and the second presenter will cover the second half. Each presenter will have 25 minutes each to present their presentation. And at last, we'll have a Q&A session. I request all the delegates or whoever is listening to the presentation to post their questions in the chat box, later which we'll be answering them. And there is a concern that most of them are not filling out the Q&A form. So kindly I request everybody to give an attempt to fill out the question and answer form, which will be shared post the session. Guys, nobody is judging y'all, so kindly give an attempt to test your knowledge and to test everybody to mute their self firstly. Brinda Krishna. Yeah. So yes, where was I? Yeah, kindly please fill the post-session Q&A also, as nobody is being judged here. So give an attempt, test your knowledge and give it a try, guys. Please don't only fill the feedback, fill the post-session also. So firstly, I request the presenters, Akshata and Ritu Pitambar, to share the screen, start the presentation. Yes, guys, you all can share the screen and start the presentation. Thank you.
Okay, ma'am. Am I audible?
Yes, you're audible.
Recording in progress.
Good evening, everyone. So we are present here for the therapeutic presentation on epilepsy. It is presented by myself, Akshata Darandale, and Ritu Pitambar Patil. So moving forward. Today we're going to see a very complex medical condition, a neurological disorder that is an epilepsy. Globally, the epilepsy is the third most common neurological disorder. In epilepsy, cluster of nerve cells, neurons, signals abnormally, which results in recurring and unpredictable seizures. Seizures is an asynchronous activity. Basically, neurons generate electrical impulse, send message, and for the organs for normal functioning. But in some cases, neurons may fire so rapidly and randomly and may many messages at the same time. This is disturbed impulses which overlaps the brain and causes the seizures, resulting in situations like involuntary movements, sensations, emotion, and behaviors. In epilepsy, abnormal electrical activity results in variety of events, that is, loss of consciousness, abnormal abnormal movement, atypical or odd behavior, or disturbed precipitation. So, epilepsy is the disorder of the brain characterized by repeated seizures. A seizure is usually defined as sudden alteration of behavior due to temporary change in the electrical functioning of the brain. Normally, the brain continuously generates tiny electrical impulses in the orderly pattern. These impulses travel along the neurons, the network of nerve cells in the brain, and throughout the whole body via chemical messenger called neurotransmitters. In epilepsy, the brain's electrical rhythms have a tendency to become imbalanced, resulting in recurrent seizures. In patients with seizures, the normal electrical pattern is disturbed by sudden and synchronized bursts of the electrical energy that may be briefly affect either consciousness, movements, or sensations. So, the epidemiology of epilepsy. Epilepsy affects 50 millions of people worldwide, with a higher prevalence in low and middle income countries. The incidence of epilepsy is nearly 3 times higher in low in LMICs compared to high income countries. In low in LMICs, inadequate medical services, poor socioeconomic conditions, and traditional beliefs contribute to the high burden of epilepsy. Globally, more than 11 million children under the age of 15-year-old have active epilepsy, with the majority residing in LMIC. Sub-Saharan countries report more than 90% of epileptic cases in children and adolescents under 20. It is incidence is highest in early childhood, with the rate decreasing as age increases into adulthood. Perinatal and neonatal complications, as well as early childhood infections, contribute to high burden of epilepsy in young children. So, here is the difference between epilepsy and seizures. So, many of us may have confusion between epilepsy and seizures. Epilepsy is tendency to have a seizure, and seizure is in our brain there is normal flow of electric current. When this electrical current becomes successive, abnormal, and spread throughout the brain, which results in the seizures. When you get 1 or 2 more episodes of seizure, then you may have an epilepsy. So the seizure is a single occurrence of jerky movement and other features of a fit. This do not need any treatment or any anti-epileptic drug or any surgery. But in epilepsy, we need to have a drug or and need to have any surgery in high risk cases. So here are the different types of epilepsy. First, they are characterized into 4 types. That is generalized epilepsy, focal seizure. Sorry, the seizures are characterized into 4 types. That is focal seizure, generalized seizures, unknown seizures, and status epilepticus. So, in generalized seizures, there is a loss of consciousness. There is no warming, symmetrical seizures, and bilateral single seizures discharge on EEG or varying asymmetry. There are 5 types of seizures in generalized seizures. First is absence seizures. Second is myoclonic seizure, tonic-clonic seizure, autotonic seizures. So, moving forward first towards the absence seizures. In this, there is no tonus, no clonus, with the brief episodes of impaired consciousness with the maintained posture. Means, in this, there is loss of consciousness. There is only present thing here is the vacant staring spell. That is, there is loss of space, or we may say it is zone out. So it can be called as a daydreaming. Daydreaming. What we can do here is hyperventilating the patient for 3 minutes, which results in automatism. That devils the facial one are most common with repetitive blinking occurring most often. The episode lasts for 20 seconds and there are multiple episodes present within a day. So here, I have mentioned that there is transient loss of consciousness with abrupt onset and termination. Sorry, accompanied by motor phenomenon, except for some flickering of eyelids eyelids, and minor alteration in muscle tone. Absence may be typical or atypical and can be often precipitated by hyperventilation. Then second one is myoclonic seizure. In this type of seizure, we can someone can misdiagnose this as a clumsiness. This occurs due like spilling of food over the clothes or the table. The technical definition of this type of seizure is brief arrhythmic jerking motor movements that last less than 1 second and often cluster within a few minutes. In this type of seizure, we may observe simultaneous jerky movements of face as well as hands. This is due to cortical representation for the facial and hand musculature is close together. In this, there is non-epileptic myoclonic movement are also seen, and physiological echoes, myoclonus or the diaphragm are on passing through stage 2 sleep myoclonus. Then next one is tonic seizures. In this, there is we also say it as a grand mal seizures. In this type of seizures, sudden stiffness or tension in the muscle or arms or legs and trunk occurs. This stiffness may last till the 20 second, approximately to the 20 second, not that. It happens when a person is asleep. If occurred when a person is awake, there are high risk of falling. Patient with Lennox-Gastaut syndrome, one or are more likely to have this type of seizure. Then next one is tonic. Sorry. Next one is tonic-clonic seizures. This is the most common type of seizure seen in the patient present in the emergency departments. We also called it as a generalized tonic-clonic seizures. There are two phases here, tonic phase and clonic phase. First, in the tonic phase, muscles of expiration will produce a loud moans or ictal cry. Here, the impaired respiration and pulling of secretions, and here the sinuses is developed in the patient's around the patient lips. That is deadly blue color is produced. Then, when in clonus phase, however, if how much physically strong we are, we can't control the patient's risk and can't control and restrain the patient's voluntary movement. Tremors can be controlled by external power, but the clonus is there, that is repetitive movement that cannot be controlled by external physical force. Then next one is atonic seizures. This can be, we can also say it as a drop attacks. Like there is sudden nodding of head or sudden falling of head, which may result in injury. This attacks last for 10 seconds. Your consciousness is regained on falling. Loss of consciousness and the duration of this can be vary. This is associated with myoclonic and tonic-clonic seizures also. Now the second type is focal seizure. Here, it begins in a relatively small group of dysfunctional neurons in one of the cerebral hemisphere. It may be held by a aura which reflects the site of origin, may or may not be associated with the change in consciousness or may be generalized tonic-clonic seizures. In focal seizures, there are two types, that is with intact awareness and without impaired awareness. So with intact awareness, there is jerky movement first of all in thumb, then it is transferred towards the index fingers, which will followed by wrist joint, and then it will be followed by elbow joints. Here, patient is not becoming unconscious for the particular time. This may occur due to abnormal focus operating in right primary cortex, which results in involuntary movements on the left hand side. And once the episode occurred, the patient will observe the weakness in the hand, which is called as taut paresis. Lots of time, patient may be having sensations like they may feel deja vu in the focal seizures. And focal seizures without impaired awareness, here the patient may look like lost or may be unable to respond to visual or verbal commands. They may have symptoms like chafing of tongue, lips, and smacking or diffic like aphasia. Now, third type of seizure is status epilepticus. This type of seizure that is lasts with 5 minutes or more of continuous clinical or electrographic seizures activity, or recurrent seizure activity without recovery between seizures. Last one is unknown seizure. That is fourth one. Here, we cannot describe the actual location of disturbances in the brain which are resulting for the seizures. Now, looking forward for the etiology, there are various factors like physiological factors and environmental factors uh, resulting in seizures. So, first, physiological factors like changes in blood gases, electrolytes, pH, and blood glucose, and environmental factors like sleep deprivation, stress, or alcohol intake. Any external or internal stimuli that damage the normal brain activity may result in seizures. So, 70% cases are of unknown etiology. Here I have mentioned 5 types of etiology for the seizures, that is genetic etiology, structural etiology, infectious etiology, metabolic and immune etiology, and last one is unknown etiology. In genetic etiology, this this is present usually in juvenile phase. We may call it as juvenile myoclonic epilepsy, that is JME, including EFHC1, and Dravet syndrome, uh, Dravet syndrome childhood epilepsy, that is CAE. Second one is structural etiology. Here, it can be acquired or genetic origin and referred to abnormal. So, abnormal structural neuroimaging. Common epilepsies caused by structural abnormals include mesentemporal and post-traumatic epilepsy. Infectious etiology. The most common epilepsy is this infectious etiology. It is worldwide. In this, generally, infections etiology refers to a patient who develops epilepsy as the sequelae of an infection and not to experiencing seizures in the setting of acute infections such as meningitis or encephalitis. Now, third one is metabolic and immunology. This is less common type of etiology. Here, metabolic changes results in seizures. And fourth one is unknown etiology. Here, we cannot predict the patient's reason for seizure. Like, patient can also present with unprovoked seizures that do not have identified cause, and thus, by definition, epilepsy is known as unknown cause. Thus, epilepsy may be due to an undefined gene or may be consequence of an unrecognized structural or metabolic disorder. So moving forward to the risk factors for the epilepsy are: first one is premature birth with a small gestational weight, then prenatal injury, which may result, example is anoxia, history of alcohol withdrawal results in seizures, history of febrile seizures, family history of seizures. Next one is physical and emotional reasons, sleep deprivation, sensory stimuli, hormonal changes occurring around the time of menstruation or puberty pregnancy, drugs like theophylline, alcohol, high dose phenothiazine, antidepressants, especially bupropion, and street drugs or lower seizure threshold may result in triggering the epilepsy. So here the pathophysiology of the epilepsy is: there are 4 types of stages over here. Like, first one is imbalances of excitatory and inhibitory neurotransmitters, then ion channel mechanism, abnormalities in potassium and ion conductance, and last one is electric potential. So first one, looking for the imbalances of excitatory and inhibitory neurotransmitters. In this pathway, the excitatory neurotransmitter glutamate levels are increased. Glutamate here, see, glutamate levels are increased, and the inhibitory neurotransmitter GABA is disordered here. This leads to abnormal firing of neuron. As a result, the synaptic current break at the neuronal membrane. Then the next physiology is ion channel mechanism. In this mechanism, there is alteration of ion channel in the neuronal membrane. Here, biochemical modification of the receptors, which further causes the modulation of secondary messenger system and thereby gene expression. Shift in the extracellular concentration. This results in alteration of neurotransmitter uptake and metabolism in glial cells. Here, the local imbalances between main neurotransmitter, that is excitatory and inhibitory neurotransmitter, and neuromodulators like acetylcholine, norepinephrine, and serotonin, which causes prolonged seizures. Then, third type is abnormality in potassium conductance. This abnormality causes due to the defect in voltage sensitive ion channels. This results in deficiency of membrane ATPase, which causes neuronal membrane instability, which ultimately results in seizures. Then next one is electric potential. Here, the nerve impulses propagation in the brain occurs in synchronous manner. The electric potential in such cases zero. The damage or irritability to the gray matter leads to activation or inactivation of the neuron, which in turn an excessive synchronous discharge, thereby generating an electric potential, which results when when this electric discharge is localized, it causes partial seizures, and when it spreads to the entire brain, it leads to a generalized seizures. So here are the clinical manifestations for the epilepsy. So first one is staring into space. Like we can see the patient with epilepsy have some symptoms like blinking of eyes or going zone out for some time. Basically, this type of seizure is seen in this type of symptom is seen in absence seizures. Then convulsion is the most common type of clinical manifestation observed in various patients. Then stiffness of muscle for a specific time is seen in tonic convulsions. Then blackout. Fifth one is falling. It is generally seen in drop attacks or autotonic seizures. Sixth one is loss of bladder or bowel control movement. This is seen in tonic or clonic seizures. Next one is biting of tongue. This biting of tongue actually happens unconsciously. This is seen in tonic-clonic seizures. Moving, the further presentation will be explained by Ritu Patil.
Diagnosis. So, first of all, history taking is important for the diagnosis and for the selection of effective drug therapy. History of following conditions must be taken for differential diagnosis. First of all, syncope means loss of consciousness. This is due to the cerebral ischemia. The onset is gradual and the patient slips to the floor. Recovery occurs after the 1 to 2 minutes and is gradual. The patient is back to normal within a few minutes. Drop attacks. This involves a sudden weakness of legs, making the patient falls. They are most commonly due to the vertebrobasilar artery insufficiency. Vertebrobasilar artery comprise vertebral and basilar artery, serves the arterial supply to cervical spinal cord, brainstem, cerebellum, thalamus, and occipital lobe. The next one is hypoglycemia, means lowers the blood glucose level in the body. The onset is prolonged and the patient is confused, sweating, and lightheaded. A time relationship to meals may be established. Narcolepsy irresistible diurnal attacks of sleepiness. The patient may experience visual or auditory hallucinations when falling asleep. The patient wakes within a few minutes, feeling well. Cataplexy, a sudden loss of muscle tone so that the patient crumbles to the ground. Micturition, defecation, and cough syncope. After these activities, patients may feel fainting. Carotid sinus syncope. This is due to the sensitivity of carotid sinus to external pressure. Postural hypotension, either autonomic or secondary to drugs. Transient ischemic attacks, especially in the posterior cerebral circulation. Cardiac arrhythmias due to impaired cardiac output. The loss of consciousness is sudden and the patient goes pale. There may be flushing on regaining consciousness. Psychogeny, there is usually some apparent gain for the patient, although he or she is seldom aware of motivation. The seizures usually only occur in front of an audience. There is often active opposition on attempting to examine the patients. There may be strange cries and flaying limbs in an attempt to mimic true epilepsy. Next slide. Um, so here are the confirmatory tests. First one is physical examination. In this, patient appearance and vital signs are examined. Patient appearance such as the signs of autonomic behaviors, upward eye rolling, unconsciousness, drooling, cyanosis, muscle rigidity was examined. And in vital signs, temperature, BP, respiratory rate, breathing sounds were examined. Next one is electroencephalogram. In this electrode placed on the scalp, it shows the electrical activity of brain.
हाँ भाई पढ़ा है हम बहुत पढ़ लिया हमने देख लिया
In epilepsy, changes the pattern of brain waves. This change shows by the electroencephalogram. Next one is magnetoencephalography, in which sensors are used to form an image of magnetic fields produced within the brain. Next one is magnetic resonance spectroscopy. It is also known as NMR. It detects the abnormal spectra of various brain metabolites. Next one is PET and SPEC. It is the most commonly used for the diagnosis of epilepsy. PET is positron emission tomography. In this, radioactive sugar is injected in body and then scan reveals the brain's blood flow and ability to metabolize the sugar. While the SPEC means single photon emission coherent tomography shows the blood flow in the brain. Generally, after a seizure, blood flow increases in the area where seizures are occurred. Next one is MRI. An MRI scan uses radio waves and magnetic waves to create an image of brain structure. And last one is CT scan. CT scan uses X-ray to produce image of brain. It can reveal the abnormal lesions or structural problems. In comparison with CT or MRI, MRI is mostly used. So next one is the treatment. Treatment goals are decreasing the number and severity duration of the seizures, improve patients' quality of life, reduce morbidity or mortality rate, ensure patients' medication compliance. Treatment options for epilepsy. First one is anti-epileptic drugs. Second one is the brain surgery. Third one is vagus nerve stimulation and deep brain stimulation. It is a procedure to put a small electrical device inside the body that helps to control the seizures. And the diet, ketogenic diet. Next slide. So here is the therapeutic strategies for managing newly diagnosed epilepsy. First, we have to consider starting a therapy after the second seizure. Then, first choice drug means we have to choose the drug appropriate for the patient's type of seizure, consider toxicity of agents, and consider patient characteristics. Gradually titrate the doses to that which is maximally tolerated or produces optimal seizure controls. If seizures are persist, then we go for the second choice drug, and the second drug is titrated to the therapeutic levels and that controls the seizure before tapering and discontinuing the original first choice anti-seizure agent. If the first drug is associated with significant adverse effect, it should be tapered while the second drug is added. Again, if seizures are persist, then Either we have to go for alternative drug therapy or we have to go for combination of two drugs. And if again seizures are persist, then we go for the vagal nerve stimulation. Next slide. Here you can observe the main classes of drugs that is mostly used with basic mechanism of action is that first one is NMDA receptor blockade, sodium channel blockade, calcium channel blockade, and GABA agonism. Here we can see benzodiazepine activates the GABA receptor, which causes the chlorine influx and leads to depolarization. Progabide is direct GABA mimetic. Tigabine blocks the removal of GABA from synaptic cleft by decreasing its reuptake. Vigabatrin inhibits the GABA catabolism. Gabapentin may augment the availability of the glutamate as a precursor in GABA synthesis and can also act as a potassium channel opener. Carbamazepine, valproate, and phenytoin enhance inactivation of voltage-gated sodium and calcium channels and limits the spread of electrical excitation and by inhibiting sustained high-frequency firing of neurons. Ethosuximide blocks the T-type calcium channel. Next slide. So here drugs are given as per the types of epilepsy. For generalized or focal seizures, the following drugs can be given. First one is carbamazepine. Dose is 400 to 1600 mg twice daily. Monitor the CBC and LFT, blood urea nitrogen and creatinine. Um, 3 to 4 days are required to steady state drug levels, and the side effects are nystagmus, dysarthria, diplopia, ataxia, drowsiness, nausea, blood dyscrasias, hepatotoxicity, hyponatremia, Stevens-Johnson syndrome, and may exacerbate myoclonic seizures. Clobazam is the 10 to 40 mg twice daily. Clorazepam 22.5 to 90 mg twice daily. Islicarbazepine 400 to 1200 mg once daily. Here the serum sodium and chloride liver by chloride monitors during the therapy, and LFT should be done. Izogabine 300 to 1200 mg thrice daily. Here ECG should be monitored. Felbamate 1200 to 3600. What?
You can continue, Ritu.
Yes. Felbamate 1200 to 3600 mg thrice daily. Here CBC reticulocyte count and LFT should be done. Gabapentin 900 to 3600 mg thrice daily. Lacosamide 100 to 400 mg BD. Lamotrigine 100 to 500 mg BD. Levetiracetam 1000 to 3000 mg twice daily. Oxacarbazepine 900 to 1800 mg twice daily. And monitor serum sodium for during the oxacarbazepine therapy. Perampamil 4 to 12 mg once daily. Next slide. Phenobarbital 100 to 200 mg once daily. Here CBC, LFT, blood urea nitrogen should be monitored. Phenytoin 200 to 400 mg once daily. Here also monitor folate, CBC and LFT. Pregabalin 150 to 300 mg BD. Primidone 750 to 1500 mg thrice a day. Refinamide 800 to 3200 mg twice daily, Tigabin 32 to 56 mg BD, Topiramate 200 to 400 mg BD. Here serum bicarbonate and blood urea nitrogen in monitor in elderly patients. Valproic acid 1500 to 2000 mg 2 to 3 times daily. Vigabatrin 3000 mg BD, Zonisamide 200 to 600 mg once daily. Here monitor serum bicarbonate and blood urea nitrogen. Next one is absence seizures. For these, clonazepam, ethosuximide, and valproic acid can be prescribed. Clonazepam with the dose of 0.04 mg to 0.2 mg per kg. Ethosuximide 500 to 1500 mg twice daily. Valproic acid 1500 to 2000 mg 2 to 3 times daily. And for myoclonic seizures, clonazepam and valproic acid can be prescribed. With the clonazepam prescribed with the dose of 0.04 to 0.2 mg per kg BD, and valproic acid 1500 to 2000 mg 2 to 3 times daily. Next slide. So this is the common side effects of anti-epileptic drugs. The first one is valproate, which can cause the weight gain, hair loss, rare idiosyncratic liver failure. Carbamazepine, oxacarbamazepine can cause rash, neutropenia, hyponatremia, ataxia, liver enzyme induction, may interfere with other medications. Vigabatrin, restriction of visual fields, which has limited its use, and sedation. Lamotrigine cause rash. Ethosuximide cause nausea and vomiting. Topiramate can cause drowsiness, withdrawal, and weight loss. Gabapentin may cause insomnia. Levetiracetam may cause sedation, which is rare. Benzodiazepines such as clobazam, clonazepam, diazepam, nitrazepam cause sedation, tolerance to the effect, increased secretions. All the above drugs may cause the drowsiness and occasional skin rashes. Next slide. So here is the brain surgery, which is the second option for the epilepsy management. First one is resective surgery. This is the most common epilepsy surgery. Here the surgeon removes a small portion of brain tissue from the area of brain where seizures occur. Resective surgery is usually performed on one of the temporal lobe, an area of the brain that controls the emotion, visual memory, and understanding language. Next, disconnection surgery. This is where the surgeon disconnects one part of the brain from another part to stop the seizure spread. This is done either by cutting the connections between two halves of the brain, or it can be done by cutting the nerve fiber in the outer layer of the brain. Third one is laser interstitial thermal therapy. Laser is used to pinpoint and destroy a small part of the brain that is causing the seizures. It is carried out in a magnetic resonance imaging scanner. Here is the vagus nerve stimulation. Vagus nerves originated from autonomic nervous system, which is responsible for metabolic homeostasis and regulation of neuroendocrine immune axis to maintain the homeostasis through its afferent or efferent pathways. Vagus nerve stimulation is where a small electrical device similar to pacemaker is placed under the skin of the chest. The device is attached to a wire that goes under the skin and connects to a nerve in neck called as vagus nerve. Bursts of electricity are sent along the wire to the nerve. It's thought this can help control seizure by changing the electrical signals in the brain. VNS does not usually stop seizures completely, but it can help make them less severe and less frequent. During the VNS, anti-epileptic drugs should also be taken. Side effects: hoarse voice, a sore throat, and cough when the device is activated. This normally happens every 5 minutes and lasts for 30 seconds. The battery for the VNS device typically lasts up to the 10 years, after which another procedure will be needed to replace this device. Deep brain stimulation. It is similar to VNS, but the device placed in the chest is connected to the wires that runs directly into the brain. Burst of the electricity sent along these wires can help prevent the seizures by changing the electrical signals in the brain. DBS is fairly new procedure that's not used very often, so it's not yet clear how effective it is for epilepsy. There are also some serious risks associated with this therapy. Ketogenic diet. Um, it is a non-pharmacological approach. It is one which contains high fat content, low carbohydrate content, and adequate protein content. This diet consists of high fat in the form of long chain triglycerides. As the fat metabolizes, it produces ketone bodies. The different ketone bodies, such as acetoacetate and beta hydroxybutyrate, are experimentally observed to have the anticonvulsive role. The examples of ketogenic diets: dark chocolates, avocados, eggs, omega 3, almonds, chia seeds, extra virgin oil, olive oil, coconut oil, ghee, and full fat dairy products. Next, patient education. Don't do hazardous activities such as mountain climbing or scuba diving. Seizures under this condition could lead to be fatal accident. Many other activities can be very dangerous if you were to have seizures. If you are on ladder or roof or operating heavy equipments or sharp tools, you could be seriously injured. Talk with the healthcare provider about any activities you are unsure of. Don't swim alone or take part in other similar activities such as driving without others nearby. Take your medicine exactly as directed. Skipping doses can affect the way your body handles the medicine, which could cause you to have a seizure. Don't drink alcohol or use any medicines without talking with your providers first. Make sure of your healthcare providers have a list of all of your medicines. Seizures medicines may interact with the other medicines. Ask your provider what to do if you take birth control pills. They may not work as well when taking seizures medicine. Get plenty sleep every night. Wear a medical alert pendant or bracelet that alerts others to your condition. The ID should include any medicine allergy. Talk with your provider. If you are trying to become pregnant, some medicine for treating the epilepsy and seizures can cause birth defects when taken during pregnancy. Folic acid may reduce the risks for some of these birth defects. Ask your providers if you should take folic acid or take other precautions. Next slide. Prevention. There is no way to prevent the epilepsy. Proper diet and sleep, staying away from alcohol, illegal drugs, and may decrease the seizures trigger. Reduce the risk for head injury by wearing helmet during risky activities. And this can lessen the likelihood of brain injury that leads to seizures and epilepsy. Next slide. We have to know what to do if someone has the seizures. The first one is the protect ill person from injury. Make sure the surrounding place is safe. Second is make patient comfortable. Lay down the person on ground and loosen any tight clothings. Third one is remove everything from ill person's mouth which may obstruct the airway. Fourth one is flip ill person on its side after the scissors ends. Stay near the ill person till awakening. Call help if scissors last more than 5 minutes. Next slide. Complications. First, difficulty in learning, breathing in food or saliva into the lungs during seizures, which may cause the aspiration pneumonia. Injury from falls, bumps, self-inflicted bites, on driving or operating machinery during a seizures, permanent brain damage due to stroke or other damages, side effects of anti-epileptic drugs. In pregnant women, some of these drugs may lead to serious drug effects. Patients.
Yes. Thank you, Ritu. Thank you, Akshata. We have one question in the chat box. I'll just read it out to you all. Any one of you can answer. Why ketogenic diet is preferred in seizure patients? Any one of both of you?
Can I?
Yeah, Ritu, you can.
Ketogenic diet may shows the anticonvulsive effects. For that, we give to these epilepsy patients.
Okay, we have an answer for that also. Chaitanya has given an answer. I could want to read it out. So the ketogenic diet's effectiveness in reducing seizures is multifaceted, involving changes in brain energy metabolism, neurotransmitter levels, mitochondrial function, and overall neuronal stability. These combined effects help create an environment in the brain that is less conducive to a hyperexcitability that leads to seizures. Okay, Chaitanya. So we have a question from Arun, which states that what are the drugs that can lead to epilepsy?
Drugs like antidepressant, dihydropyridamines, like cocaine or methylphenidate, tramadol, isoniazid may result in seizures.
Okay. So, yes. We have one more question from Periya Swami. Why folate levels are monitored during phenytoin intake?
Phenytoin may increase the folate level, so it may worsen the condition and cause metabolic abnormality. Therefore, we monitor the folate level.
Okay, could you just repeat it and try to elaborate a bit like how exactly it happens?
Sorry.
Okay, it's okay. We can move on to the next question. Could you differentiate between convulsions, seizures, and epilepsy?
Seizure occur due to an electrical disturbances in the brain, while the convulsion describes the involuntary action of jerking or in a contraction. And epilepsy, as I have mentioned it, that in epilepsy we see the symptom of seizures. We cannot say it as a symptom, but in epilepsy we observe the seizures like one or more, two or more than two seizures. Then we can consider it as an epilepsy.
Okay, thank you, Akshata. We have a question from Sadhya. What are street drugs? Give examples and how does it trigger seizures? Yes, any one of you can answer.
Street drugs are illegal drugs or like illicit drugs which contain alcohol or cannabis, cocaine, phenyl.
Okay. I see Vrinda raising her hand. Vrinda, would you like to ask any question or?
Yes, Tejasvi. I want to ask a question, but I felt if I write it down on the chat bot, it will go a little bit long. So my question is, one is that ki I have because during the presentation I was looking for a slide, but mostly it was there was set of drugs for the time you have to take in a day. But I recently read a journal in which it was stated that if you start taking anti seizure or anti epileptic drugs, you have to take it for 5 years duration. And the reason for that, the medicinal doctors and the pharmacists resonate is that ki the number of frequency in between the two seizures, if you increase, there will be no seizure in the future. So I wanted to ask that one question, pointing that ki, is it possible that by increasing the frequency that you got the seizure in this 1 year, 5 years you didn't have any seizure because of the anti-epileptic drug, so you will not have anything like that. So I want to have ask this one question, because in the slide there was this one portion in which she mentioned ki you are completely free from seizure, like cured. So I want to ask, is there a curing completely of epilepsy? The first question was that, and the second question is that are we able to have any pharmaceutical formulation? Because you mentioned about pregnancy, that some of the drugs cause birth defect. It's very quite common because we are using drugs that are crossing the triple B, so that is also able to cross the placenta. So is there any possibility to formulate drugs that doesn't cross the placenta so that we can overcome the birth defect? These two are the questions.
So the answer of first question is we take anti-epileptic drugs for 5 years. The reason is that for if we stop or abrupt the taking of drugs, we may have relapse. So for preventing relapse, we need to take drugs for 5 years continuously. And about the another the question she asked, that may the disease will be completely cured. The answer is we can't say that disease can be completely cured, but we can say the symptoms or the severity may be reduced or may be decreased.
Okay, thank you, Akshata. Does anyone want to add on this answer? You all can actually like unmute yourself and then please speak out.
Tejasvi, actually, I'm having a one case of obsopronous myoclonus syndrome with the developmental regression. That patient is continuously from the 1.5 years. The patient is diagnosed with the epilepsy. She's a small child, about 3 years old now, and he's also suffering from the epilepsy. And continuously, the patient is on the sodium valproate syrup as well as the haloperidol tablets. Then also the patient is continuously having a severe attacks, and the other factors also plays an important role in the patient growth, like if the patient is a deficiency of the nutrients, like the patient is belonging to any rural areas, that can also lead to epilepsy. Because if the patient is living in the rural areas, then there may be a nutritional deficiency like the folate deficiency, etc., that can lead to a developmental regression, and that developmental regression can further lead to a obsopronous myoclonus syndrome. That is a type of the severe critical condition of epilepsy.
Okay, thank you, Arun. I think Chaitanya, would you like to speak or shall I read it out from the chat box? Okay, so Chaitanya said that valproate or levetiracetam has a low risk in pregnancy and even lamotrigine. So he wants to add on this point. Okay, so we'll move on to the next question, presenters. Can eclampsia lead to seizures? So Ritu has already answered it. Yes, eclampsia may cause neurological defects such as stroke, which may cause seizures. Could you elaborate how, or if you have any idea? It would be nice. Yes, Ritu, are you there?
Please repeat.
Okay, can eclampsia lead to seizures? Could you just elaborate that answer that you have already given in the chat box?
Eclampsia may cause the neurological defects such as stroke or any other stroke, necrosis in brain, or any other brain damages, injuries may affect the neuronal activity of the brain, and it disturbs the electrical activity, so it may cause seizures.
Okay. So what are the anti-epileptic drugs that should be avoided during pregnancy? So, yeah, I think this question is answered. Could you all just wanna tell it again? Yes.
We can there are many drugs which affects in pregnancy and cause the toxicity, such as valproic acid.
Okay. Okay. We'll go to the next question. If the patient is highly obese, then what will be your drug of choice? I think any one of you can answer, Ritu or Akshata. If the patient is highly obese, then what would be your drug of choice? Yes, Ritu or Akshata, can we move on, or would you all answer the question?
Sorry, ma'am.
Okay, I think we can move on. Could you please differentiate between generalized motor scissors and generalized non-motor scissors? Yes, guys, kindly answer.
In motor scissors, it involves the muscles activity, while in non-motor scissors, it usually involves behavior arrest. Like both are the types of scissors under the generalized seizures or focal onset. But in generalized, there is like muscle spasm or loss of consciousness or falling in motor seizures. But in non-motor seizures, there is unconsciously happening things like movement of hands, blinking of eyes, or chewing movement, something like that.
Okay, so for the previous question, we have an answer. Topiramate is associated with weight loss, which can be beneficial for obese patients. So the similar answer was given by Sadhya and Chaitanya. Thank you for answering. We have one more question from Vrinda. Vrinda, if you would like, I think you can like unmute yourself and ask. It's okay. Yes.
This is this one question that there is seizures and epilepsy episodes that happen in mothers after postnatal, like after the delivery, she experienced this kind of epilepsy, and they are kept under observation. Most of the case it persists, and after in most of the case it's restrained after a period of time. So I want to know what is the causative factor for such kind of seizures, because there is no trauma or anything. And the second is what this these kind of scissors comes under which category?
Yes, would anybody like to answer Vrinda's question?
Electrographic or electroclinical seizures.
Could you just repeat it, Akshata, as you were not so audible? It's okay if it is, you are just trying, you can just tell it. Okay, it's okay. We'll get back to your answer, Vrinda. Would anybody like to answer the answer for Vrinda's question?
Tejishi, I think the factors that can contribute to a post that is a seizures can be any condition like the any nutritional deficiency in the patient. Like during the pregnancy time, the nutritional deficiency is one of the important factor that plays an important role. While the eclampsia condition, that is the before the pregnancy, the eclampsia condition that is during the pregnancy, it can also lead to a, it can play an important role. While the infections also. So thus on the basis of the clinical features only you can differentiate the seizures because all these etiological involved in the that is the pathophysiology of the seizures only.
Okay, thank you, Arun. Do we have any more questions, guys? Okay, guys, I've shared the feedback and the post-session Q&A. So please kindly fill both the forms. Both will be considered for the attendance. So please give, at least try to give an attempt. Don't only fill the feedback. Please fill both the forms. So yeah, Chaitanya has a message. I think you all can read. Preeclampsia is a condition characterized by high blood pressure and often proteinuria. Preeclampsia involves widespread endothelial dysfunction where the cells lining in the blood vessels do not function properly. This can lead to vasospasm and decrease blood flow to the brain, increasing the risk of seizures. Thank you, Chaitanya. You explained it very well. I hope it's clear, Vrinda. Guys, please fill both the forms. Both the forms will be considered for attendance. And both the forms will be accessible only for 10 to 15 minutes. So please fill the form.